Arthritis pain got you feeling like an ancient relic? Before you start asking for museum admission, let's dive into some smart and slightly quirky ways to outsmart those cranky joints and reclaim your groove. Number 10. When life gives you lemons, stretch. Managing arthritis pain can feel like a lemon thrown at you when you are not looking. But before you think about giving up, remember this: stretching is your new best friend. Gentle exercises can keep your joints flexible and reduce stiffness. Think of it as your morning coffee, but for your joints, necessary and mood-lifting. Start with easy stretches targeting the affected areas, like your hands, knees, or hips. A morning stretch can feel like a refreshing shower for your bones, waking them up and preparing them for the day ahead. Plus, it gives you a valid excuse to channel your inner yogi, minus the complicated poses. So stretch it out daily, even if it is just for 5 minutes. Your joints will thank you for the effort. Number 9. Food fights. Winning the battle with an anti-inflammatory diet. They say you are what you eat, so why not be something that fights inflammation? Incorporating an anti-inflammatory diet can significantly alleviate arthritis pain. Foods rich in omega-3 fatty acids, like salmon and chia seeds, act as tiny firefighters dousing the flames of inflammation in your joints. And let us not forget the power of antioxidants found in fruits and vegetables. They are like the bodyguards that protect your cells from damage. Swap that processed snack for a handful of nuts or berries, and you might feel the difference sooner than you think. It is not about denying yourself tasty food. It is about eating smarter. Imagine every bite you take as a mini warrior heading into battle for your health. So go ahead, arm yourself with a rainbow of fruits and vegetables. Number 8. The hot and cold treatment. It is not a mood swing. Managing arthritis pain can sometimes feel like a roller coaster ride, but applying heat and cold therapy can help level things out. Heat treatments like warm showers or heating pads work wonders to soothe stiff joints and improve circulation. It is like giving your joints a warm hug, telling them it is okay to relax. On the flip side, cold packs can numb the sharp pain and reduce swelling, acting like a security guard who quickly removes unruly inflammation from the premises. The trick is to know when to use what. Use heat when you wake up with stiff joints and cold after a long day of movement when your joints feel swollen. Alternate between these two as needed and notice how they become your go-to methods for immediate relief. Number 7. Weight management. Lighten the load, lighten the pain. Carrying extra weight is like asking your joints to lift heavy suitcases all day. The more weight they carry, the more strain on your joints, especially on your knees, hips, and spine. Losing even a small amount of weight can have a big impact on reducing arthritis pain. Imagine your joints throwing a tiny party every time you shed a pound. With less pressure, they move more freely, and the wear and tear slow down. You do not have to run a marathon to lose weight. Simple changes like reducing sugar intake and taking short walks can do wonders. This approach not only helps alleviate pain, but also boosts your overall health. So think of it this way: every pound lost is a pound of pressure lifted off your aching joints. Number 6. Medications. Not a magic pill, but they help. Medications can be like that superhero sidekick in a movie. Not the star of the show, but essential for saving the day. Over-the-counter pain relievers like acetaminophen and non-steroidal anti-inflammatory drugs can help manage mild to moderate arthritis pain. For those needing something stronger, doctors may prescribe disease-modifying anti-rheumatic drugs or biologics that target the root cause of inflammation. While they are not a cure, these medications can significantly reduce pain and improve joint function. The key is finding the right balance, so always consult with your healthcare provider before starting any medication. Remember, the goal is to manage pain effectively so you can get back to the things you love without feeling like your joints are in open rebellion. Number 5. Exercise. It is not just for fitness buffs. Yes, exercise can feel like the last thing you want to do when you are in pain, but it is one of the most effective ways to manage arthritis. Low-impact exercises like swimming, cycling, and walking can help keep your joints flexible and your muscles strong. Strong muscles act like shock absorbers, taking some of the burdens off your joints. Think of it as training your body's defense team. The more you move, the less stiff you will feel over time. Even better, exercise releases endorphins, your body's natural painkillers. So not only are you helping your joints, but you are also boosting your mood. The trick is to find an activity you enjoy, so it does not feel like a chore. This way, you are more likely to stick with it and reap the long-term benefits. Number 4. Physical therapy. Your personalized plan of action. Physical therapy is like having a personal coach for your joints. A physical therapist can teach you specific exercises to improve flexibility, strength, and range of motion tailored to your unique needs. It is not a one-size-fits-all solution. It is a customized plan designed just for you. Physical therapists also teach you how to use assistive devices if needed, making everyday tasks easier and less painful. Consider it an investment in learning how to move correctly, so you are not unintentionally adding to your pain. Regular sessions can equip you with techniques to manage flare-ups and reduce the likelihood of future joint damage. It is like going to school, but instead of homework, you get relief from pain. Number 3. Mind over matter. Meditation and relaxation techniques. When managing arthritis pain, sometimes you have to train your brain to get on board. Stress and anxiety can make pain worse, creating a vicious cycle. Enter meditation and relaxation techniques. Mindfulness meditation, deep breathing exercises, and progressive muscle relaxation can help reduce stress and, in turn, lessen the perception of pain. It is not about ignoring the pain, but rather changing how you respond to it. Picture it as giving your brain a calming background track to play, making it less likely to amplify the pain signals. Start with just a few minutes a day, focusing on your breathing or a calming mantra. With practice, these mental exercises can become a powerful part of your pain management toolkit. Number 2. Assistive devices. Your new sidekicks. Sometimes, managing arthritis means accepting a little help, and that is perfectly okay. Assistive devices like canes, splints, or jar openers can make daily tasks easier and less painful. These tools are like having extra hands to help carry the load, reducing the strain on your joints. For example, using a cane can take pressure off a painful knee, making walking more manageable. Splints can provide support and stability to weakened joints, allowing them to rest and heal. These devices are not signs of weakness. They are smart strategies to keep you moving and independent. Think of them as your sidekicks in the battle against arthritis, always ready to lend a hand or a cane when you need it. Number 1. Consult a specialist, because you deserve the best care. If arthritis pain is significantly affecting your quality of life, it might be time to consult a specialist like a rheumatologist. These are the experts in diagnosing and treating arthritis and related conditions. They can offer a more comprehensive treatment plan that might include advanced medications, injections, or even surgical options if necessary. Remember, you do not have to tough it out alone. Sometimes, getting a professional opinion can open up new avenues of relief that you might not have considered. It is like getting a map when you are lost. You suddenly have a clear direction on how to manage your condition. So if over-the-counter solutions are not cutting it, make that appointment and give yourself the care you deserve. Managing arthritis is a journey, but with the right strategies and support, you can take control and live a more comfortable, active life. That's all for today's video. If your joints feel better after this, imagine how much better life could get with a like and subscribe. Hit that button and let's keep the good vibes rolling. No achy knees allowed.